Greetings. Today what I'd like to address is healthcare killers. And this is a topic that you don't hear that much about probably in the press because it appears to be relatively rare, at least as far as identification of perpetrators and victims and successful prosecution. So probably we have the tip of the iceberg here in our research, and there's probably a lot more healthcare killing that occurs that goes undetected, and I cannot say how much. Of course, the vast majority of healthcare workers are very concerned professionals who are watching out for the welfare of their patients. And indeed, we see that when there are suspicions of mistreatment, it is often other healthcare workers who notify their supervisors, administrators, or investigators about their worries or concerns. Of course, with the healthcare murder situation, the victims are usually very vulnerable. And not only are the victims vulnerable, but the perpetrator is in a situation where they have a lot of control and they have specialized equipment, they have medications, they may have a lack of supervision, and in a sense, the murder weapons are already there and may be very difficult to trace. For example, various medications. And when people die in hospitals or nursing homes, that they may not even conduct an autopsy, or it may not look as suspicious since they're already in a location where ill or frail people might be found. And what we see again is that even though healthcare murder, serial murder is probably relatively rare, when it does occur, there's often multiple deaths over lengthy periods of time. And you can see also that since the 1970s, at least in the United States, that we've investigated more cases. In the 1970s, your author points out 2 cases were investigated compared looking up into 2002-2009 time period, around 19. If we look at the in those that we were aware of, healthcare providers that were charged with attempting to murder their patients, we see that 66% were nurses, 22% were nurses aides, and 12% were physicians. Of those in the nursing personnel, 55% that were prosecuted were female. And most of these murders occurred in hospital settings, and the victims were more likely to be either very young or very old and to have serious illnesses. And the most common method of murder was the injection, but often multiple methods or combination methods were employed. For example, in one study, 52% of the deaths were caused by injections and 11% by suffocation, and then 25% were unknown, and then the rest were a variety of other methods. And of course, we remember that that we have people who have access to medications that could be used, such as insulin, epinephrine, potassium chloride, morphine, and so on. One interesting point that your author makes is that often these healthcare providers who kill their patients may be diagnosed with Munchausen syndrome. That this gets into a whole other area. What I'm more familiar with in my own work in working in Child Protective Services is Munchausen syndrome by proxy, where a parent or caretaker makes the child ill in order to gain attention of the hospital. And so here we have to ask, is there a situation where someone working in the hospital is creating illnesses to get attention or to try to save the patient? after they make them very, very critically ill in an emergency situation, or are they trying to kill them? Or a combination. For example, maybe they're trying to make the patient sicker, and the patient ends up dying. So these are certainly cases that we have to take a closer look at. There's a variety of poisons that can be used by the healthcare serial killer that they find in healthcare settings. And of course, these are poisons. They're also medications that are used to treat. But when used in a larger dose or in certain combinations, this can lead to fatalities. Often we see that there's a variety of different types of drugs that are used, but the opiates are relatively common. And so we see that used probably in about a quarter or so of the cases. There's some interesting case studies that you can read in your book, and we also see your author bringing up the concept of that some of these healthcare killers see themselves as angels of death who are actually engaging in mercy killing, trying to stop the suffering of ill patients. Of course, this would not hold up in court, but that may be an excuse they use, or maybe they actually believe that. Once I was working in a facility, and I pointed out to a physician that there were many people that were higher above me, probably about 10, that I knew: my boss, my boss's boss, my boss's boss's boss, etc., etc. And I asked a physician who was way up there who was their supervisor, and the physician looked at me and said, "God." I thought that seemed just kind of a strange answer in that sense, because I was kind of wondering, well, who do you go to if you have questions? I don't know. It just struck me as certainly interesting, because I couldn't think of who this individual supervisor would be. In many of these cases, though, in the healthcare setting, we do have supervisors. But we have to remember that denial may often operate and also cover up. I've seen another setting where a mental health professional came down from another large governmental organization with raving reviews. He was the best mental health professional, a great manager, a great supervisor, and he took over this large unit at a hospital setting, and he was terminated 5 days later after he interviewed everyone in the unit, and to say the least, he was inappropriate and bizarre in his interactions. But remember, he came with these, excellent recommendations and reviews, as if they were trying to get rid of him at one facility by saying, "Yeah, really, you're, today, that may be less likely to happen because of liability issues and publicity, bad publicity." One of the things, though, is trying to figure out who would become a healthcare killer. First of all, they're, as I mentioned, relatively rare, and secondly, that often these individuals would look to be quite normal and likable and sociable, and so investigations would have to lead for looking at clusters or patterns of deaths that are unexpected, and also looking at if there's a relationship between the rates of death per certain shifts or particular healthcare providers. And they'd also have to take a close look at if there's any type of situations where you find some type of misbehavior, or things like extra syringes or missing medications, or cuts in feeding tubes or IV lines, and also that other complaints that were not pursued. These are things that may be warnings, but again, it's extremely difficult, and certainly we need more information to construct a good solid psychological profile, or psychological profiles or typologies of different types of healthcare killers. And as I mentioned before, I have more experience dealing with cases of Munchausen syndrome by proxy, where we see infants and children who are seriously harmed and sometimes killed by their parents or caretakers. But we have to wonder if there's some similarities in the dynamics there. And this wraps up this video.